educators at KGR.
Health coaches help people figure out the how, not necessarily the what is wrong. So we're not there to tell you what you need to do to get better. We're there to figure out with you, how can you get better? Because we all at the end of the day know what we need to change. You know, how many of us have left the doctor every year and they're like, oh, well, you need to eat less sugar. You need to do this. The education piece isn't the breakdown. The breakdown is figuring out, how can I integrate this into my life right now, knowing that I have kids, knowing that I have to go to work, knowing that I have to do these things. That's where the health coach steps in, is the health coach takes what we know we need to do, what we want to do, and we say, okay, how can we implement this change? And in doing that, that's where we allow that autonomy. We're not going to tell them how they need to change. We're going to let them discover the best way to change, because they ultimately know. If I were to say, Larry, you got to work out at 6 a.m. every morning because we know you have to exercise, and you are not a morning person, that is going to fail miserably, right? Versus,
can you see that in me?
versus if I just simply said, Larry, what do you think would be the best way to implement a little bit of movement into your life right now? Then you would have all kinds of ideas. You know, I could probably walk my dog right after dinner. So it's just a very different approach than what most people are used to, because we're just asking the questions in a very different way and allowing that person to actually answer the questions, because they have the answers. We're just evoking it out of them.